Whether it's systolic heart failure, often caused by coronary artery disease, or diastolic heart failure, often caused by chronically high blood pressure, the complications are similar. Your heart is failing to properly circulate blood around the rest of your body. The left side of your heart is supposed to pump blood to the rest of your body, but if the heart muscles aren't strong enough or they don't fill up with enough blood, then the blood just stays in the left ventricle and eventually backs up into the lungs, causing pulmonary edema. And the right side of your heart is supposed to pump blood to your lungs. That way, that blood can pick up oxygen, and then it can be pumped by the left ventricle to be delivered to the rest of your body to feed it oxygen. But if the right side of your heart isn't strong enough or it doesn't fill up with enough blood, then your blood ends up fighting gravity in your veins and ends up pooling in places like your hands and your feet and your ankles, and we call that peripheral edema. Obviously, extra fluid in the lungs, as well as the ankles and feet, doesn't feel good, so cardiology experts typically like to rely on the kidney to get rid of this excess fluid, particularly the loop of Henle. And that's because this thick ascending limb of the loop of Henle is responsible for like 25-30% of our sodium reabsorption. But in the case of heart failure, we don't want to reabsorb our sodium because lots of sodium in the blood means lots of water is sticking around. And that blood volume is increasing, which can also exacerbate hypertension, but mainly heart failure because that means more fluid can get trapped in the lungs and in our ankles and feet and hands. So this makes a great target for some diuretics. The tried and true loop diuretic furosemide, blocking sodium reabsorption at the thick ascending limb of the loop of Henle. That way we are peeing out our sodium and water, and that way we're getting rid of it from our lungs and our ankles, relieving edema. Unfortunately, I've had some of my colleagues push the dose of furosemide up and up and up, all the way to like 200 milligrams per day. That's a lot, by the way. When in reality, there's some sort of loop diuretic resistance happening, whether it's distal tubule hypertrophy or actual like edema in the gut. That way we're not getting proper delivery of the drug, so reduced bioavailability, or just straight up like no perfusion to the kidney because of the heart failure. And to that I say, consult nephrology, and instead of continuing to titrate the dose of the loop diuretic, try adding on another diuretic. Like if there's distal tubule hypertrophy, try adding a thiazide diuretic. This will decrease sodium reabsorption at that site in the kidney. Hope this helps and hope you learned something.